Hi, I'm Spencer McCombs, Doctor of Physical Therapy from McCombs & Associates Physical Therapy, and I'm here to talk to you about knee pain. Knee pain is super common, as many of you know. We have patients of all ages that suffer from knee pain. Some of our younger patients have a lot of what we call anterior knee pain, where it hurts around their kneecap and just below their kneecap into their tibial tuberosity or along their tendon here. Other patients we have may have suffered from a traumatic injury like a meniscal tear or an ACL tear, and maybe having surgery, recovering from that, or maybe getting ready for surgery. And then of course other patients we have are dealing with arthritis and maybe trying to avoid a knee replacement or recovering from a knee replacement. So I want to show you some of the techniques that we do in physical therapy to help the knee get stronger and to help it get looser. So generally with our patients, we always start with a hands-on technique, finding areas that are stiff or tight in the knee and working through these areas, also working out swelling. It's very common with people that have knee problems to also develop swelling and inflammation in their knee. So these techniques help to relax and to move that swelling out of their knee and back into their circulatory system. Okay, next, to loosen up the knee, we actually start some stretches, and I'm going to show these to you. Go ahead and lift up your legs for me. These are stretches that you could work on at home. The first of which, you just grab a rope or a belt or a strap, and we're going to stretch your leg up into this direction, working on the bend. So use the strap to help, and just stop about right there. And you just hold to where you feel a gentle stretch. If it hurts, you're going too far and back off. You hold for about 5 seconds and then relax it all the way down and then come up again. So it'd be good to do 5-second holds, repeat this about 10 times. And by the 10th time, your knee should be a little bit looser. If you do this once or twice a day, after a couple weeks, it'll be a lot looser. And pull up again. So those are called heel slides, and that really helps to loosen up the knee joint. Okay, the next exercise is to activate the quadriceps muscle. It's actually called quad sets, and it also helps to improve the straightening of the knee joint or knee extension. So if you take a small towel and just set it under your ankle, then you're going to tighten up this quadriceps muscle, and in the process pushing your knee down into to the bed or the table, and relax. So you can see that he's tightening up this muscle, pushing the knee down, getting full extension, and at the same time getting this muscle to strengthen and activate. And you hold that for about 5 seconds as well, and repeat it 10 times, stretching it out. Just make sure it doesn't hurt, you're not pushing so far to create any pain with that. Okay? Next exercise is called straight leg raises, and we're going to do 2 directions here. If you'll go ahead and bend up your left knee. So keeping the left knee bent up like that, that'll support the back when you raise your leg. So we're going to start with a quad set. So he's going to tighten his leg downwards, point his toes back towards him, and then raise your foot up. So he raises it about a foot to a foot and a half off the table, holds for 5 seconds, and lowers it down, keeping it straight the whole time. This is a little more of an advanced exercise, but it really helps to get that quadriceps muscle stronger. Go ahead and raise up again, hold for 5 seconds, and then lower it back down. Okay, then I'm going to have you lay on your left side for me, and we're going to do straight leg raises up to the side. Now this strengthens one of the most important muscles in the leg that we have, and that is the hip abductors or the gluteus medius muscle. So that's working on this muscle through here as you raise up to the side. So go ahead and straighten this leg out, bring your leg up to the side, and hold it there. So we're working these muscles right through here, and that helps to control the knee joint. So these hip muscles are very important. A 5-second hold, repeat those 10 times. Doing these once or twice a day, after a couple weeks, the muscles will start to get stronger. And the last one, if you'll sit up facing me, please, is another quadricep strengthening exercise. It's called long arc quads, or I'm going to have you just raise your knee up, foot up like this, hold for 5 seconds, and then lower it down. And then repeat that again. So these are exercises that we generally do on all of our knee patients that tend to be very successful. If you're having knee pain or knee problems, as long as you're cleared by your doctor, you can start doing some of these exercises and see if they help. Otherwise, come by and see us at McCombs & Associates Physical Therapy or Level End Physical Therapy, and let us show you what we can do to help your knee pain get better.